Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about continuing professional development and education. I know I have talked about staff development in the past, and I've talked about the importance of going to professional conferences and webinar participation, but I wanted to talk a little bit around the why behind it. And I know in those videos I do provide some why, but I feel like I have a little bit more specific examples why, especially for providers, provider owners, managers, administrators, that it's important for continuous development and education, not only so you can pass it along to your staff, but it's also to help make sure that your organization is doing the best it can, it's the most informed it can be, and it's just setting everything up for a really good situation, both financially, patient safety-wise, business world-wise, and staff satisfaction can also play into that too. I am sure you have heard all the buzz about the increasing talk and excitement around AI, artificial intelligence. It's kind of taking over the world a little bit right now, not literally like it probably will someday, but just about like all of the spaces in different fields, including healthcare, that AI is enhancing things and possibly taking over some jobs someday because of the capabilities. Right now we're not there, but it's something to keep in the back of your head. But this continuous development and education regarding AI is super important, not only to see if there's things that can enhance workflows and improve some functionalities in your practice or reduce some stress from staff's responsibilities, but just to kind of see where things are going and to make sure that you can stay competitive out there as well. So that would be one of the number one reasons, is the constant and quickly advancing of technology, not just with AI, but there's a lot of other stuff out there too, as far as treatment approaches and other kind of modules that can be used, not just AI related. There's a lot of different things out there, medical devices that could enhance a patient's experience, their health, and your staff's overall happiness if you're taking burdens off of them. So that's one of the really big reasons that you'll want to stay up with the changes and doing the development and education. If you've been in healthcare long enough, the number two reason is the constant changing of compliance and regulatory standards. Healthcare is infamous for this, and I feel like with the technology constantly advancing, they're having to then change regulatory and compliance to go along with it. And so you just have like this rapid, like, oh my gosh, this has changed, this is new, this has changed, this is new. And it's so hard to keep up on unless you have different facets of keeping yourself educated in the loop, getting newsletters from different sources, watching YouTube channels, participating in webinars, going to conferences, participating on forums online of different practices in your area with the same specialty, or all administrators or things like that, groups that can communicate and help one another. We have to lean on one another. It's impossible for one person to stay up on all of this. And in small private practices, unfortunately, it usually falls on one or two people, and it's just really difficult. So making sure you're using all your resources that you can and making sure that you're staying up on all of this the best you can as well. Number three, and I've done a video about this as well, is that there's a lot of payers, insurances integrating with corporations. Amazon, CVS, going with, Humana, or going with Blue Cross Blue Shield. And although the need is there because of the lack of providers going to primary care or rural health, they're trying to fill some of these needed areas. but it also can become a competitor to you, right? And you might start going, oh my gosh, I didn't know that this was going on, because you weren't paying attention. You weren't staying up to speed on all of this by participating in all of the different various resources I just talked about, and it kind of nips you in the bud, and you're going, oh my gosh, I don't know how we're going to compete with that. So if you know about it ahead of time and you kind of keep your eye and your ear on it, and you kind of go with it, that's going to be the best way to handle those situations. And maybe those aren't going to affect you right now, but it just seems like there's more and more partnerships going in, and maybe eventually it's going to. So just kind of being aware and in the know, keeping it in the back of your mind, and dealing with it when you need to is always a good idea. Another reason to stay up on professional development and education is because healthcare models are constantly changing. The pandemic seemed to have kind of sped up some of that with, the adoption of telehealth very quickly across many platforms because of the changing of the requirements and stuff like that. Home-based care is growing rapidly with the baby boomers aging. We have a lot of kind of integrated or flex, what's the word I'm looking for? I'm drawing a blank on, SNF care mixed with providing care at people's homes versus in an office. Like, we have providers that are doing some in-office care, and they'll go to some patients' homes, and then they'll go to a skilled nursing, and then they'll do a rehab or something like that. And so we're seeing a lot of this mixed kind of bag model right now too, and we're seeing the increase of value-based care versus fee-for-service care, and it's just kind of all over the place. So if you're not on top of this, you could miss out on a really good opportunity for your business practice, patients, situations, and you don't want to be behind the ball. So staying up to date on all of this is super important, and things are changing rapidly right now in more than one realm, as I'm pointing out today. And my last point I want to make about why it's so important to stay up to date on these developments in education is because of the insurance policy changes. I can't keep up with how much insurance has changed their policies. And I feel like it's like as the wind changes. And I know that's an exaggeration, but that's how it feels sometimes when you're like, what? Why is this getting denied now? Or what? Oh my gosh. I get provider bulletin newsletters once a month, the beginning of the month, from Cigna and Blue Cross. And I saw something from Blue Cross yesterday, because it's the beginning of the month, saying that they're going to decrease E&M codes at 50% reimbursement when a modifier 25 is put on a preventive exam. So you can see a patient for a preventive exam, you can bill for the E&M code using a modifier 25, but they will only reimburse that E&M code at 50% of the normal reimbursement, because they'll be paying for the preventive, which I understand, I get it. It's just a small example of all of the different payer guidelines and policies that are constantly changing. And it's not just for medical, it's for pharmacy, it's for diagnostic imaging, it's for dental, I'm sure is changing. I don't do a lot in dentistry or the dental world, but I'm imagining it's kind of the same. And if you're not getting these newsletters, if you're not making an effort to check the insurance policies and payer guidelines online, if you're not attending webinars and staying informed with forums and groups and stuff like that, you're going to be left behind, and you might end up losing money. And nobody wants to do that, especially small private practices can't afford to do that. So that is why it's super important to be staying up on professional development and education as an administrator, as a provider, as a staff member, as a third-party vendor, a billing specialist, a coding specialist, a credentialing specialist. And we all have to do our continuing ed units requirements depending to keep our certifications, our licensures. But this might be in addition to what is required, because a lot of these things that I research independently or have things that I read on are not going to give me points towards keeping my medical assisting certification, but it's stuff that's helping me in my career in healthcare in general, and to be able to help one another too. So Good job watching this video. That's one step in the right direction. But really, if you haven't been very good at staying on top of your own professional development and education in healthcare, if you haven't encouraged your staff or providers to do the same, it's really time to start, because things are rapidly changing, and I would hate for you or your staff or your providers to be behind the ball, and it affects business, patient safety, patient care. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with anybody in healthcare that you associate with that you feel would benefit. Thank you so much for the support. We'll see you next time. Bye-bye.